In this video, we will be discussing consultation management in Aasaan ERP. By the end of this video, you will know creating patient encounter records, recording vital signs, recording symptoms and diagnosis, treatment plans, and clinical procedures. Patients and healthcare practitioners encounter is the most important activity of healthcare providers. This consulting needs to be set up by making sure all the relevant information is made available to both parties, providing a consolidated view of the daily schedule of the patient encounters will help practitioners to prepare for the day. Scheduling the usage of service units like consultation and nursing rooms improves both patient and practitioner experience. Vital signs of a patient needs to be recorded as this will help practitioners assess the patient's condition. The symptoms and the diagnosis needs to be recorded. Further, the treatment plans, clinical procedures, and lab tests recommended need to be communicated to the relevant parties. Let's see consultation management in action in Aasaan ERP. Let us consider a patient has an illness and registered into the system. The practitioner will now consult him with a further course of action. It is quite possible that some lab tests may be required or if it is a crucial or critical diagnosis, the patient will have to be admitted to the hospital. All this will depend on what the consultation is recommended. In Asan ERP, we can streamline this entire process. Let's see how it can be done. To begin with, we will start with appointment type. Appointment type allows us to predefine the duration of the appointment, specify whether it is inpatient, and set colors to differentiate between different appointment types for analysis. Let's navigate to the appointment type list first. So here we will have all the predefined appointment types which has been already added into the system. And if we would like to create a new one, we'll click on the add new button. First, we will enter the name of the appointment type. Then we'll select the inpatient checkbox, and if it is ticked, the appointments created under this type will be used for inpatient department care. Set the default duration and choose a color for each appointment time. Moving forward, let's add billing details. We need to select the appropriate price list, then click on Add Row and select the medical department. We will then select the outpatient consulting charge item and the inpatient visit charge item, which will fetch the charges based on the price list selected. Once we have all we have added all the details, we can click on Save and proceed further. When a patient wants to consult a practitioner, it is necessary to book a prior appointment since it helps manage the patient as well as the practitioner's time efficiency. In order to create a patient appointment manually in our healthcare system, we can use the following steps. We'll go to patient appointment under the consultation menu, and here we will get the list of all the appointments which has been already created. To create a new one, we'll click on the plus icon. Here we will select the patient, and after selecting the patient, we will select the patient wants to consult which health practitioner, and after that, which department he wants to consult. After that, we will select the appointment type. The duration will be fetched automatically from the appointment type. Then we will select the clinical procedure template and the therapy plan if they are applicable. Then we will enter further details such as payment information and if other health practitioner has referred the patient to the current practitioner, we will add him up here. And if there is any other remarks to be made, we will note it down here and we will proceed and save the appointment. A clinical procedure is any practice of a health practitioner that involves the combination of special skills or abilities and may require medicines, devices, or both. We can create templates so that you don't have to enter the consumable rates and linked items every time we create a clinical procedure for a patient. So to create a clinical procedure template, first we will go to consultation setup. Under there, we will find clinical procedure template and we'll click on the create button and we'll get this document and we can add the template as per the requirement. Now that we have created a clinical procedure template, we can create a separate clinical procedure manually. Let's navigate to the clinical procedure list from the menu. It will be available under consultation clinical procedure and we will get the list of the clinical procedures which are already created. If you wish to create a new one, we'll click on the plus icon and we will proceed to create a new one. Select the procedure template. The warehouse, medical departments, and the consumables will be fetched automatically from the template. If we have created an appointment for the clinical procedure, we can select the appointment. It will fetch the procedure template, patient start date and time, etc. Enter or edit details of consumables in the consumable section. Select the service unit if it is not set, and the procedure will be conducted in that unit. If some samples will be collected during or after the clinical procedure, create a sample collection document and link it. And finally, save and submit. The vital signs of a patient needs to be recorded, and this will help the healthcare practitioners assess the patient's condition. So to record the vital signs in the system, we'll go on the consultation and over there we will find the vital signs. So to create a new vital sign, we'll click on the add button and here we'll select the patient and the time. Next, we can enter details of the vital signs like body temperature, heart rate, or a pulse, respiratory rate, and blood pressure. Further, the observations on the tongue, abdomen, and reflexes can also be entered. Additional observations can also be entered in notes. The details of the height and the weight of the patient can be entered in the nutritional value section. Once the height and the weight is entered, the BMI will be calculated automatically. A patient encounter means professional contact between a practitioner and a patient, whether an admission, consultation, diagnostic, operative, or invasive procedure at the hospital. Since this is a very important interaction, we need to record every encounter with patients through the patient encounter module. Let's see how we can create a patient encounter record. We can navigate to the healthcare domain and click on the patient encounter under the consultation menu. Here we will get a list of all the patient encounters. To create a new patient encounter, we'll click on the add button and upon clicking the add button, we'll get the document to fill up all the details regarding the new patient encounter. Here we will first select the patient, the healthcare practitioner, and enter the encounter date and encounter time. If the patient has booked an appointment, the same can be selected. Next, enter the symptoms and the diagnosis. Once the diagnosis is done, the medical core of the condition observed can be entered. Next, the detail of the drugs prescribed along with the dosage period and the dosage form can be entered in the medication section. If any lab tests are recommended, the details of the same can be captured in the investigation section. The details of the clinical procedure recommended can be captured in the procedure section. Lastly, if any therapy are being recommended, the details of the same can be captured in the rehabilitation section. Once the patient has had an encounter with the practitioner, based on the diagnosis, the lab test therapies, procedures, or the medications will be prescribed depending upon the patient's medical condition. Many times, the treatment prescribed is the same for many patients, and adding data entry becomes a repetitive task and the doctor's time is consumed. Instead, we have an option to pre-configure this frequently used item in a template called a treatment plan template. During the patient encounters, all these items can be filled automatically and can be updated on the fly if required. Let's see how we can create a treatment template plan. Firstly, we will navigate to the consultation setup menu, and there we will find the treatment plan template. Over here, we will get all list of all the templates which has already been created, and we can also create new templates as required. First, let's give this template a name and add a medical department where this plan will be frequently used. A set of conditions like complaints, diagnosis, gender, and patient age range can be set on each plan template. This will help us in filtering care plans for the patient encounters. Next, we will see the plan item section. Here, the therapy type, clinical procedure template, and lab test templates items can be configured. When applying a treatment plan template from the patient encounter, these items can be filled automatically. Lastly, a set of drugs along with the dosage, duration, and form can be configured here. After filling up all the required details, we can click on Save. And we can use this template once created in patient encounter so that the healthcare practitioner does not have to enter all the repetitive details again and again for different patients.